talk, Dr. Tarek Loubani, about the state of the medical system in Gaza and the impact of the Israeli blockade, and describe just what that is. Were you taken to Shifa yourself?
I wasn't taken to Shifa. Shifa is considered the premier hospital in Gaza. However, by the time that I was shot, Shifa was well and thoroughly overloaded. There was a kind of round-robin disaster system, and it was very clear to me that even though I might have received better care at Shifa, that there was no way that I deserved to go there. So I was sent to a different hospital, which provided me great care and did everything that was needed, but was completely overwhelmed as well. Every hospital here is overwhelmed. I work at Shifa as a rule. I work in that emergency room with Dr. Ayman, the one who you showed. And really, the situation there is very dire in normal times. In normal times, I don't have the anesthetics to freeze people when I sew them. In normal times, I can't give people pain medication like morphine. In normal times, it's very, very hard to find even gloves for my patients or gauze for my patients. So the situation is terrible in normal times. Now that there's this disaster that is happening, this disaster unfolding all over Gaza, it's been even worse. I mean, it's gotten to the point where, in fact, I had to very carefully pick who it was that I'd use gloves on when I was in the field because we have a shortage of gloves. Had to pick who I would use bandage on because we have a shortage of bandage. These things are not supposed to be caught by the blockade, but they are. De facto, the hospitals are in a complete disaster scene. And I must say, it makes it so that my complaints about lack of supplies and services when I'm in Canada, it makes those complaints really come into perspective when I'm here just trying for the absolute basics. I wasn't in Shifa that day. I have not been able to go to Shifa since because I can barely walk. Today was my first outing. However, having said that, I have heard from my colleagues at Shifa. They're devastated, they're traumatized, they don't know what to do. They were piling bodies in corners. I mean, it's terrible. They are very good at what they do, but everybody has limits, and every hospital has limits. And if this were downtown New York or downtown Toronto or downtown any other metropolis, they would not be able to deal with the devastation that was faced.